We're now going to look at how to do CPR on a cat. So the first thing you need to do is make sure that everything's safe. So it may well be your cat has been electrocuted or there's been some chemicals. So obviously you need to make sure that you're safe to approach the cat. Once you do that, you need to find out whether they are responsive. So call their name, rub them, try and get some kind of reaction out of them. So you want to try and see if there's any way there's a response there. Next thing you need to do is to find out whether they're breathing. So to do this, you can lay them down and you can pop your ear down on the side of their chest or put your hand down there to see whether you can feel that the breaths are going in and out, which is a good indication, in which case if they are breathing, you do not need to do CPR. But if you can't detect any breathing, next you need to find out whether there's any circulation. So again, you might be able to put your hand and feel for a heartbeat or pop your ear right down onto their left-hand side to see if you can hear for a heartbeat. And you do this check for around about 10 seconds. If you're not sure exactly where to put your ear, if you just bend their leg back, the front leg back, roughly where their elbow meets the chest is the point you're really looking at concentrating on. So popping your ear down there and finding out whether there's a heartbeat. Next, if there is no heartbeat and there is no breathing, next we need to move on to CPR, compressions. So what we're doing with that is we're encircling your hands around their chest and using your thumb over here onto the same position we said where the elbow meets, and you're doing compressions, and you're doing 30 compressions around about a third the depth of the chest. So that is quite a long way, because we must make sure that we squeeze the heart, and also we must make sure we fully release, because when you push down on the chest, you're forcing blood out to the heart, and when you release, it's sucking it back in. So if you don't release fully, you're not going to fill the heart back up again. So we're doing those compressions, and we do 30 compressions. Once we've done the 30 compressions, we can move back to the mouth and then just check in the mouth. And then what you're doing is you're blowing in, and you can blow with a cat over the mouth and the nose. So if you can, pull the tongue away slightly to open the airway up, blow in, and you're giving it 2 breaths. And once you've done the 2 breaths, allow the chest just to start rising. Don't overinflate it, because you'll then eventually blow air into the stomach, which is not good. So just until you see the chest rise. So when you're blowing in, look down the body as you're doing it, deliver the 2 breaths, and then straight back on to the compressions, and you're doing a 32, 32, and then hopefully you'll get a response back. If you do get a response, immediately stop and immediately get the cat to the vet. Now, if there's 2 of you, it may well be that one of you can continue this while the other one can drive to the vets, or put the vet on speakerphone and talk to the vet as well, so that maybe they can help you what you're doing. But literally going through, after every couple of minutes, just check, stop and check to see if they are breathing. So again, put your ear down there. You're listening for breathing. You're also listening for a heartbeat. If you detect breathing, the heart is going to be working. So just check that, and if necessary, you can continue.